Okay, so we are well into the third week of the second Trump administration, and there has been a lot of healthcare related news, to say the least. So we're going to try and take a 30,000-foot view and explore some of the most critical impacts the new White House has had on healthcare and health policy.
I think it might be helpful to start at the beginning. Now, during the very first week of the second Trump administration, acting HHS Secretary Dorothy Fink sent a memo to employees pausing all public communications until February 1st. And caught up in that communications pause was the CDC's very respected journal, Morbidity and Mortality Weekly Report.
Basically, it was the first time in more than 60 years that MMWR did not publish as scheduled. Past CDC leaders and editors of MMWR told us that this was unprecedented, and they lamented that a scientific publication was getting caught up in a communications pause.
Another way the administration has been dampening communication has been through its orders on diversity, equity, and inclusion initiatives.
The CDC was removing pages from its website that mentioned DEI issues. This includes pages on health disparities among LGBTQ youth, preventing HIV, guidance on the Mpox vaccine, and so on. Some pages have been restored, but not all. OB-GYNs are worried that CDC guidance for contraception and vaccines may be purged in the coming weeks. So the American College of Obstetricians and Gynecologists is now hosting PDFs of government-issued guidance that they've endorsed. We're watching a lawsuit brought by a physician group called Doctors for America that has sued federal health agencies to get the pages restored.
So MedPage Today's editor-in-chief, Dr. Jeremy Faust, also had a scoop over the weekend that CDC told its scientists to retract or pause the publication of any manuscript under consideration at any journal to make sure that no, quote, forbidden terms appear in the work. Jeremy obtained a copy of the list of terms, and it includes things like gender, transgender, pregnant people, and LGBT. At least one journal, the Journal of the American Public Health Association, has pushed back, saying it won't be complicit in that kind of censorship. Basically, it will be using its peer review process to make sure the work meets its own standards of publication.
And amid all of this, we've also had the confirmation hearings for Robert F. Kennedy Jr., who is Trump's pick to lead HHS. This week, the Senate Finance Committee gave him the thumbs up, and now we're waiting for the full Senate vote. It wasn't clear he would actually get over that initial hurdle, though.
That's right. During his confirmation hearings, RFK Jr. didn't seem to know a lot about Medicare and Medicaid. He was conflating Medicaid with the Affordable Care Act exchanges. He didn't really know the differences between Medicare Parts A, B, C, and D. He was also pressed extensively on his views on vaccines. And this was a real sticking point for one physician senator, Dr. Bill Cassidy, who people thought might vote against RFK Jr., but after many negotiations, Cassidy said Kennedy and the Trump administration pledged a very close working relationship and made some promises about not pulling certain info from CDC websites and abiding by current vaccination standards. But public health experts were a bit skeptical of that deal.
And then there were a few other healthcare-related DC stories we've been following this week. President Trump signed an order for the government to stop funding youth gender-affirming care through programs like Medicaid and TRICARE. But even some private hospitals are now pausing their gender care programs.
We also saw the gutting of USAID, which does a ton of work in global health, including administering parts of PEPFAR, a 20-year-old bipartisan initiative to treat and prevent HIV/AIDS across the world.
Keep checking back with MedPage Today because we will be covering it all.